Hello, and warmly welcome to this panel discussion on becoming an agent of change and going from thought to action. My name is Samuel Sandboge. I'm an MD and the creator of the Planetary Health Now MOOC. And today I have the privilege of being joined by Olga Gilbert, who is a politically active MD and general practitioner. Hanna Rintala, MD and chairperson of the organization's Physicians for Social Responsibility and for the Climate Physicians. And Taneli Saari, co-founder of Tunne ry, a non-profit organization addressing eco-emotions. Warmly welcome to all of you.
Thank you. Thank you. It's nice to be here.
My first question goes to Olga. When did you first become interested in issues relating to the environment? And when and why did you decide to pursue a career in politics?
Nature has always been very important to me, but it was after I got my first child when I got more interested in environmental issues. And to politics, it was when I was working at the health center as a GP, and I noticed that I was not able to help people because the reasons why they are getting sick are somewhere else than in the health sector, and that was the reason why I decided to go for politics and also combine the environmental and health themes there.
And how have you felt? How has it worked to combine these two careers for you?
It's interesting, and also I like it a lot because I can go get to the subject from different angles, and it all comes together in some way. I like to work as a clinical practitioner, but also I like to work as a politician, and then I all the time I get feedback from my patients and from the health sector, and I can use that in politics and the environmental issues as well. I'm studying and trying to learn more.
Thank you. Taneli, could you tell me a bit about Tunne ry? You were one of the organization's founders. Could you perhaps tell me about the process that led to the foundation of the organization and also how it has developed through the years?
So roughly 10 years ago, a dear friend of mine whose opinions I value very much got into the climate research, and she went through this phase of climate anxiety, and it kind of transferred to me as well. And then her background as a psychologist gave her skills to process these emotions, and also my background is in social work, so I kind of have the sort of similar skill set, and we both went through this kind of time when we expressed difficult emotions, and we were really surprised about the imbalance between reporting on climate and environmental issues and the kind of stern message that the science was giving back then. So then we decided that we have these skills. We would like also to share them to everyone who goes through the same kind of things. And that's why we didn't start a business. We started a non-profit and we started to hold workshops and some trainings to different organizations and workplaces and so on, schools. And then we have had during these years peer groups and online groups and different places for people to kind of come together and share their experiences, thoughts and emotions, and kind of get some sort of tools to process these things. And also one important thing was to find people who think alike or similarly enough, and also to take some sort of action. And during these years that we have been active, we started from small, but kind of I'm really thankful for the interest that we have gotten since the beginning. But now we're involved in some national and also some EU level projects. And I'm really thankful for that kind of work.
That's really wonderful. Yes, congratulations on that. So, Hanna, I'd be interested to hear a bit about the Climate Physicians. Can you tell me a bit about the organization and its goals and how it has developed through the years?
Yes, Climate Physicians started like a network of people who want to use their knowledge in healthcare as professionals to also like include the aspects of planetary health and how like the recent development is affecting people's health all over the world, and how we can affect and influence the society to become more sustainable for all. And it's like a free network of different professionals. There are also many other healthcare professionals than just medical doctors who are also involved in this, and like nurses and other professionals. And we are also we also have this umbrella organization, Physicians for Social Responsibility, and we want to welcome all people who want to like find a way to do something about and make their own way or their own kind of change in the society in these issues.
And do I remember correctly that you've done some lobbying activities as well through the years? Yes. Could you give me an example of that?
Yeah, many of us are meeting politicians and different decision makers and giving information to them about this. It's although we think that everybody kind of must know somehow that climate change and all these other hazards are affecting human health, but it's not clear to everybody. So there is also a need of knowledge still, and to clarify how urgent these things are, and on the other hand, how we should not kind of be paralyzed by the urgency, but to be able to connect our all our strength and abilities.
Yes, it's really great. Thank you. Yes, so my next question is actually for all of you, and whoever wants to answer first, feel free. So the question relates to your perceptions on affecting change. Do you think what are the differences and the challenges of affecting change through politics, for example, compared to activism or other kinds of non-political ways of affecting change? And feel free, whoever wants to reply first.
Well, yes. I think, in my opinion, I have met many people who think that both activism and politics are somehow foreign or feel a little bit uncomfortable easily or something. But I've also met many people who have kind of come over this threshold to start, even if it feels a little bit uncomfortable or something like this. So probably it depends on the person which one is the more likely direction.
Yeah.
How would you?
And I think that we need different pathways, different ways to make the difference, try to make the difference. So for me, it's more natural to negotiate and make like political goals, long-term goals, and then go step by step towards those. And then for someone else, it's easier to go to a demonstration and that those are both are needed to make a change.
Yeah, I totally agree with you, and I have seen it from my personal view. I know I wasn't meant for politics or research, but I'm pretty good at supporting people and bringing them together. So I thought that I could support all those activists and researchers and politicians as well.
And it's nice how you are using the skills that you already have to make a difference. So it doesn't have to be something that you learn completely new thing to try to get things better.
Yeah, and if it feels like an unknown property to start either activism or go into the politics, it's always helpful to think that you don't have to do this alone, or even like myself, I have everything has kind of happened through meeting people and discussing with them, and so it has become like natural to do this kind of things.
Yeah, it's about finding the people who think alike.
Yeah, and the community, it's more than just like individual efforts.
Yeah. Yes, politics is definitely a slow way. So if you want to make a fast change, then some other kind of activism or voluntary work is better, maybe.
No, I mean, it's really interesting what you're saying, and I think there's a lot of similarities with what we see in planetary health as well, that we must understand that these are big issues that can't be solved by just one discipline. We need to collaborate. We need multi- and transdisciplinary collaboration. And this insight is also relevant to how we approach these issues. And also, I would say that there are some similarities to what I've seen or anyone sees in the everyday clinical work as a general practitioner, for example, that the most important thing is not exactly what kind of exercise the patient does, but the important thing is that they do some kind of exercise. So there are a lot of similarities here. I have two small, short questions that I'd like to ask you as well. And if possible, I would like you to answer with just one short sentence. The first question relates to everyday life. If you could ask people to do just one change in their daily life to improve the environment, what would that be?
Politicians never answer in one sentence, so I'm not gonna follow your guidance. I would tell people to take care of their own health. Yes. Because the things that most of the things that you do for your health are good for the climate as well.
Yes. What about you, Danneli?
I have maybe found the dietary choices the most easy. It requires no extra energy to stop eating something.
Yes.
And focus on something else.
So you're thinking about more plant-based diets, for example?
Yeah.
Yes. Yeah. Yes. What about you, Hanna?
Yes. I think I would say that consume less and also do less, and just be and concentrate on what you love and what you care for the most.
focus on the non-material values rather than
Yes.
the stuff, the things.
Exactly.
Yes. Thank you for these suggestions, really great suggestions. The second question, which is also a short one, the final question relates to people who want to make a change, who want to get engaged with these issues. What would be your recommendation for someone who wants to become an agent of change but doesn't know where and how to start?
Do you want to answer first?
Yeah. Yeah, I want to encourage everyone to do something, because through what we do, we are connected to the world, and there are always people who are willing to respond in a positive way when you do something. Sometimes it's difficult to find, or it may take some time to find your own way or your own place to make an influence, but eventually there will be people, and we welcome everyone to our network.
I think help is needed in every sector, and big and small action, and I just encourage people to look up and contact anyone and get started joining people. Start from there.
And you can start from very small things. You don't have to change your everyday life in the beginning or at all, but choose those things that seem to be the easiest ones.
Yes.
And find other people and do it together.
Wonderful. Thank you very much. Thank you for your contributions and your wise words. This was a wonderful conversation. I'm really glad that you were here today. Thanks. Thank you also to everyone who has watched this video. Goodbye.